Welcome back to our COVID-19 special edition here on Channels Television. Now, Bauchi State Governor, Mr. Bala Mohammed, he has tested positive to the novel coronavirus. The governor had gone into self-isolation on Monday after admitting that he had contact with the son of the former Vice President, Atiku Abubakar, on the flight from Lagos to Abuja. The senior special assistant to the governor on media, Mr. Non-Mgt, said in a statement that the governor was tested alongside his family and aides that accompanied him on the trip in Lagos. Now, the statement adds that of the 6 initial tests carried out, 1 sample was confirmed and it turned out to be that of the governor. He's still in quarantine and being attended to by officials of the Nigeria Center for Disease Control, NCDC. In the meantime, we were supposed to have a briefing from the Ministry of Health today, but it was postponed. Let's hear from our correspondent, Friday Kerigbe, who tells us more on why that happened.
This is where the Minister of Health was supposed to brief the journalists about the update, the recent update on COVID-19. Unfortunately, an aide of the minister just came in, the SA technical to the minister came in a while ago, and he told journalists that the briefing has been stepped down. No date has been given other than to tell us that a new date will be communicated to journalists and a new time will also be communicated to us. No concrete reason for the cancellation was actually given other than to tell journalists that the meeting of the Presidential Task Force on COVID-19 is actually ongoing at the Secretary to the Government's office. And this is actually supposed to be the second news conference on the update about COVID-19 today. The first one was actually scheduled by the SGF, which was initially scheduled for 9 a.m. Journalists waited for about 2 hours, and that briefing was actually postponed. We were asked to come back at about 1:30, which we did, and later on we were told that that briefing was cancelled.
Our correspondent there, Friday Kerigbe, telling us on that latest. Now we have joining us Dr. JAPHET OLUGBOGI, a public health physician, is also chairman COVID-19 committee, the Nigerian Medical Association, NMA. Thank you for joining us.
Thank you for having me.
I remember the last briefing with the Minister of Health. He talked about how the NMA hasn't perhaps liaised with the Ministry of Health on what they can do to assist. I mean, I'm sure you heard that. What do you make of perhaps such comments coming at this time that all hands should be on deck?
Well, the minister has a lot on his hands, but we believe that if he feels that the NMA hasn't reached out to him, he can also reach out to the NMA, because he's also a member of the NMA. Besides, the NMA has been doing a lot on this COVID-19 saga, especially in Lagos. I saw a circular, and I saw a lot of COVID-19 committees set up by the NMA National. Also in Lagos, for instance, I'm the chairman of NMA Lagos COVID-19 committee, and we've been doing a lot. We've been making a lot of
one good thing they did was the chairman announcing that, you know, doctors should be hands on deck, that no one should go on strike.
Yes, that's part of what the NMA is doing. And apart from that, it sent a lot of letters, circulars, memos to all the affiliates, MD-CAN, ARD, mention them that all doctors should be hands on deck.
So would you say that all medical personnel, take for example Lagos, where we have the highest number of active cases, are ready to fight the scourge, this pandemic?
Absolutely, but we need to urge the NMA would like to urge the government to reach out more to the private doctors, private practitioners, so that can be all inclusive. It's an inclusive responsibility for all of us. The government needs to get gadgets, PPEs, materials and all that, face masks and sanitizers, also give to the private practitioners as well, so that they can all, you know, do their own duties. You know, the thing is very expensive and even hard to reach in the market. So if government procure as much as possible and give to the private practitioners, give them training. I know the government, I'm aware the government has done a lot of training for private practitioners, but they can do much more.
So what quick tips can you give us in terms of protecting ourselves and, you know, isolating this pandemic?
Well, one thing we shouldn't do is wearing gloves around. I saw a lot of people around today driving around Lagos wearing gloves, and you know, when you wear gloves and you're not a health worker, you have a false sense of believing that you won't be harmed. You know, but what you end up doing is spreading germs, spreading the viruses, if possible, to other people around you. So don't wear gloves around. All you need to do is wash your hands as much as possible. Use hand sanitizer when you can't get water and soap, and then ensure that you isolate yourself as much as possible from other people. Avoid the gatherings of a large crowd. Avoid the gatherings of people at this moment in time. Also, the NMA believes that the government should shut down the country, should shut down Lagos State as it is now. What happens when you have a fish pond and some fishes are dying? What do? You take those fishes away and ensure that you treat them so that they don't infect others in the pond.
So are these directives not enough? We're talking about Thursday,
yes,
shutting down markets.
The state government is trying to do it in phases, which is the right thing to do anyway. But as it is right now, I think we need to take a drastic measure.
All right, so if you were to say where we're headed right now as everything stands, as we're also seeing the pandemic reduce, abate in places like China where it started, I'm going to ask you the same question. There is hope, isn't there? There is hope.
There is hope for us. Like I said, we have 40 cases now. Exactly a week ago, we have 3. That is 3 times 14. That's 42 cases in 1 week. But then, it's just 42 cases. We can manage 42 cases. If you manage 42 cases well and manage the contacts well, we can mop up the cases from the society. But we have to isolate ourselves. People have to go into self-quarantine.
All right, we'd like to thank you, public health physician, Dr. JAPHET OLUGBOGI, for joining us on this special edition of COVID-19. Let's go to our correspondents in some states of the Federation. They've been monitoring the level of compliance as directed by some state governors. In Imo State, the government has asked all of its staff above the age of 45 to work from home beginning March the 25th. The governor gave the directive after the government delivered hand sanitizers to be distributed to public places. Our correspondent, Pekute, tells us more.
Good evening. Welcome to Owerri, the Imo State capital. As of today, no case of the coronavirus COVID-19 has been reported in Imo State, even though a few days ago, the Imo State Governor, Opuzodinma, inaugurated a COVID-19 committee headed by Professor Maurice Iwu, saddled with the responsibility of ensuring that this deadly virus does not find its way into Imo State. The committee has so far established isolation centers and emergency centers across the state. In case anyone is showing any symptoms of this COVID-19, they could be referred to these isolation centers as quick as possible. Earlier today, the government procured in large quantity hand sanitizers, which will be distributed across ministries, departments, and agencies of the state, as well as communities at the local government level.
We have also decided to close all nightclubs, all late-night restaurants. In fact, by tomorrow, civil servants above 45 will be encouraged not to come to work because they are the most vulnerable group. So that people on essential services only that are within this age bracket, we will encourage to come to work. And we will also support them with programs that will ensure that this disease or virus does not affect them.
He says all these measures are being put in place to ensure that this deadly virus is prevented in Imo State. We'll continue to keep you up to speed with events and happenings around here in relation to the COVID-19 virus. Please do stay safe. It's back to you in Lagos.
Thank you, Pekute, there from Imo. In the meantime, the management of the Nigerian National Petroleum Corporation, NNPC, has directed all office-based staff below management cadre across all its formations nationwide to work remotely from home with effect from today. A statement by the corporation's Group General Manager, Group Public Affairs Division, Dr. Kenny Obatero in Abuja, gave the directive where it conveyed to the NNPC workforce via message signed by the National Oil Companies Group Director, Mr. Mele Kyari. The NNPC boss has directed all NNPC strategic business units to activate their business continuity plans immediately to ensure minimal disruption to operations while protecting staff from exposure to the COVID-19. It's our COVID-19 special edition on Channels Television, and I'm Millicent Walker as we wrap up this segment. But of course, it's coming back your way, 9 p.m. Don't forget, it's a daily update at noon, at 6 p.m. and a 45-minute update at 9 p.m. on the coronavirus pandemic in Nigeria and across the world. Thank you for watching. Stay with Channels Television, your home for the news.